Hi, I'm Dr. Patrick Andersen of Madison Maximize Living. Oral and dental health is an important part of overall health. Unfortunately, too many people give inadequate attention to their oral health. This week's guest is Madison's dentist, Dr. David Ducommun of No Fear Dentistry. Join us as we discuss what it takes to have good oral hygiene. We'll cover sonic toothbrushes, water picks, tooth cleaning, preventing and dealing with tooth loss, and much, much more. Coming up next on Maximize Living. Welcome to Maximize Living. I'm Dr. Patrick Andersen. Our guest today is Dr. David Ducommun of No Fear Dentistry. So today we're going to talk about good oral hygiene and dental care as it relates to your optimal health. And Dr. David, welcome.
Thanks for having me.
Yeah, glad to have you here. Oh, tell us a little bit about your practice and where are you located?
Well, we're on 344 South Yellowstone Drive, so Yellowstone and Gammon, Yellowstone and Mineral Point. We just have a passion for patients that want to have a great experience in the dental office. So it's not about the filling, it's not about the crown, it's not about the cleaning. It's about actually going there and leaving saying, man, that was really easy, or that was a great experience. So that's what we focus on.
Yeah, and I've noticed that about being in your office. It's really a wonderful experience. Highly trained team. I'd highly recommend their office. You know, I've heard that not enough people go to dentists, however, though, and that concerns me. What percentage of people go to dentists on a regular basis?
Yeah, so I'd say routinely we see about 50% of the population. And you know, that's for many different reasons. Maybe some people have just experienced a move and they're new in town and they're busy starting a new job or school and just haven't established that relationship yet. For some people it could be financial. For some people it could be that they just have a lot of fear and they're not sure that they can actually have a good experience, so they're not willing to call.
What happens to those people that don't get dental care? I have the same sense with people who don't get chiropractic care. You know, how do you reach them, and what happens to their health?
Well, so there's two things we fight in dentistry. You know, we basically fight dietary things and we fight bacteria. So with dietary things, it comes down to, you know, acidic beverages and sugary beverages, and those cause decay in people and they accumulate over time, right? And then the second thing is bacterial. So you know, bacteria causes decay and it also causes gum disease. So we're going to have a progression of all of those diseases as time goes on. The other thing that you sacrifice by not coming on a routine basis is reinforcement of great habits. You know, we can give you some feedback on how you're brushing or how you might want to, you know, do some home care differently. And if you don't come in on a routine basis, you can't get that feedback. And so that's really important in health and you know, as well as in the business that you're in. You want to give people good habits at home.
Do a lot of people, Dr. Dave, do they wait for pain to come in? Is that a pretty big indicator for many?
Yeah, I would say that about 70% of our new patients come in as a routine new patient for our 2-hour exam and get the comprehensive exam. I'd say about 30% of our patients come in as emergencies where they're in pain, they have an abscess, they have an issue that needs some acute care.
So what would be some of the things that would cause pain?
Well, most of the time we find that it's either a periodontal infection or a dental infection from some decay that just got out of control.
Would that be like an abscess?
That'd be like an abscess too.
Yeah.
And those will get your attention and make you, no matter what, want to come in and get some kind of acute care.
And I've had patients in the past where their headaches were not responding to chiropractic care, and they said there's something else going on, and I've referred them to dentists, and they did find an abscess tooth that was actually causing their headaches.
Very common.
There's a real tie-in.
There's a tie-in, and a lot of times when pain is initially felt, it doesn't localize itself. And as time goes on, we can start to, you know, take some X-rays and localize some symptoms and actually come up with a diagnosis that's going to help them.
Now you mentioned bacteria in the mouth. What is plaque?
So plaque is the white sticky layer that can form on your teeth if you don't brush your teeth on a regular basis. And it's just a layer of bacteria that matures over time and becomes more pathogenic the thicker it gets.
Okay.
So that's the same plaque layer that causes decay, and it's the same plaque layer that invades your gums and causes gum disease.
Well, that's not a friend at all.
No.
So we'll be back with more with Dr. David DeCommon on Maximize Living. Stay tuned.
Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv.
Welcome back to Maximize Living. I'm Dr. Patrick Andersen. Our guest today is Madison's dentist, Dr. David DeCommon. And Dr. David, before the break, we were talking a little bit about plaque buildup. And are there different types of plaque, or if they're there a long time, are they worse? How does that affect people?
Yeah, so there's plaque that forms above the gum line, which is primarily what causes decay and gingivitis. But as that plaque causes more inflammation in the tissue, it permeates down into the gums, underneath the gums, and then it becomes a periodontal issue where it actually causes inflammation of the inside walls of the pockets. And that causes then bone loss around the teeth, and that's periodontal disease. So the plaque is progressive, and it's something, you know, when we say brush and floss daily, that will get that white plaque off of the teeth, and you'll avoid the gingivitis and then, of course, the periodontitis that follows that, and the decay.
That sounds like a pretty important thing. How often should people brush, and how often do they?
Most people, I would say, are doing what I would recommend, which is brushing at least twice a day. We recommend flossing once a day, and the water pick is another tool that acts completely differently, because brushing and flossing remove attached plaques that are actually attached to the structure of the teeth. The water pick actually removes the floating plaque, which is pathogenic bacteria underneath the gums that causes, again, gum disease and root surface decay and that kind of thing. So the water pick is a fantastic tool as an adjunct with brushing and flossing.
So really most patients would benefit, or most people would benefit from having a water pick and a sonic toothbrush.
Absolutely. Everybody should have
things
that.
they could do.
Absolutely, yeah. And especially for kids with braces too. Those are tough to brush. So that's another great time to have the Sonicare as well as the water pick.
Oh, that's awesome. Is there any type of toothpaste or materials in toothpaste that you like or don't like?
I always say this, with children, younger children especially, make sure you're using a very small amount of toothpaste, and you can use a children's toothpaste for that. As far as adults go, there's tartar-controlled toothpaste, there are bleaching toothpaste, and there's just standard toothpaste. And I don't get too picky about it, to be honest. I say use the toothpaste that you like the taste of and that's not too abrasive for your teeth. Some of the more aggressive toothpastes have larger particles, and you can feel them kind of crunch in your teeth, and those can be more abrasive to the teeth, which isn't always a good thing.
Is baking soda considered abrasive?
Yeah, baking soda can be kind of abrasive to the teeth.
I've heard of things like oil pulling, where people will rinse their mouths with cotton or coconut oil and swish it around for several minutes. What do you think of that?
Well, there's been research where they do like a Paradex rinse versus just doing oil pulling, and there is no benefit greater with an oil pulling than there would be with like a Listerine or a Paradex. So people are doing it, and it is keeping their teeth squeaky clean. It's just that if it's working for you, great, but expect about the same results as you would get with an ADA approved mouth rinse.
What about particular foods that could cause issues with the teeth? And what should people do with beverages, for example? What kind of beverages are problematic, and is there anything they can do after they have them to negate some of the effect of them?
Well, if you talk to the pediatric dentists or the ADA, what they're now recommending is that if you're going to drink a beverage between meals, make sure that it's water. Water doesn't have sugar in it, it doesn't have acid in it. Any of the other beverages that have those things will cause your teeth to break down if there's enough time for those things to be on the teeth. So in other words, if you sip a beverage all day long, and it's got acid or sugar in it, it's going to break the teeth down. Whether it's a soda or a sports drink or anything that has citric acid, phosphoric acid, or sugar. So what you want to do is drink those things with a meal, drink them rather quickly, and then you want to drink water, swish with that, and keep sipping on the water all day long. You will not have new decay if you do it that way.
You'd probably do better on calorie control too, because it's that snacking in between with those sugary drinks that cause issues that way.
I suspect you could cut a few hundred calories, yeah.
We'll be back with more with Dr. David Ducommun after the break.
Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv.
Welcome back to Maximize Living with our guest, Dr. David Ducommun. We were talking earlier about plaque and plaque buildup and so much a person can do at home with a water pick and flossing and sonic toothbrushes. But there's more that needs to be done, apparently. When is the cleaning, and how often should cleaning be done? What does it do?
Yeah, so our standard cleanings, which is a prophylactic cleaning, meaning you don't have gum disease, you have maybe some gingivitis or some buildup of tartar, happens typically once every 6 months. Some people can stretch it out to once a year. They also need a doctor exam, a dentist exam once a year in order to be seen at that clinic. So legally, that's something that we need to do to check for oral cancer and that sort of thing. So once a year to see the doctor. But what happens is over time, we can build up a little tartar, it's the harder sort of stony stuff that collects on the roots of the teeth. And that's something that you can't get off with a sonic toothbrush or flossing or water picking, so that has to be taken off by the instruments that a dental hygienist is trained to use. So again, every 6 months to a year is a good time for a regular prophylactic cleaning. Now if someone has gum disease, which is again actual loss of the supporting bone, it's a little more frequent. We usually say every 3 to 4 months to come in for what we call a periodontal maintenance. But because they've had some bone loss, it's not just cleaning the crowns of the teeth anymore. Now we're actually cleaning root surfaces. And so that takes a little more effort, a little bit more time. But again, very important to prevent from having a furthering of that periodontal disease or structure loss.
Do some people build up plaque and tartar at different levels or rates? Is it their lifestyle or their genetics, or is there variability much in that?
Yeah, there is a variability, and it depends on salivary flow, it depends on habits, it depends on beverages and all those sorts of things. But yeah, different people build both tartar and plaque at different rates. And it also depends on the effectiveness of toothbrushing.
Is there a lack of skill in toothbrushing in some patients?
Well, yeah, it takes a tremendous...
Lack of time, perhaps? They're in a hurry, they go brush.
I think time can be an issue, but it's also, actually understanding all the surfaces of the teeth. And, we say, even with children, let children start the brushing process, the parents can finish it, because the children don't really understand the three-dimensional aspect of all the teeth and surfaces and gums and all that kind of thing. So, yeah, it is sort of a complex thing to actually get the plaque effectively removed off the teeth.
Do you recommend brushing the tongue as well?
Yeah, brush the tongue because that harbors a whole lot of bacteria, and it's got, sometimes it's got fissures in it. It's got all kinds of, different bumps, and yeah. So we also have at our office we have tongue scrapers. You can actually scrape the plaque off the tongue, and that's a great way to remove billions of bacteria.
Excellent. All right. Well, what are some of the foods that stain teeth?
So,
what are the concerns with staining?
Yeah, so typically staining isn't that big of a deal because that's going to come off with your routine cleaning and polishing. But foods that are going to do that are beverages, any dark beverages like the dark sodas, coffee, tea, any dark foods like blueberries and that sort of thing. And they will cause an extrinsic staining of the teeth. But again, that's something that typically comes off at your regular cleaning.
Now, are there any products or medications to be concerned about with the staining of the tooth, either extrinsically or intrinsically?
Yeah, so mostly intrinsic staining comes from one of the antibiotics. It's doxycycline or tetracycline if it's given to a child under 8, 9 years old. Mostly after that, the teeth are formed and they won't have that dark gray deposit in the teeth. But primarily, just that antibiotic causes the intrinsic staining as far as medications go.
And is there anything to be done once that happens?
Once that happens, it's sort of a permanent thing, and if you were going to get rid of it, you could try external bleaching. It's very difficult though.
Yeah. Well, when we come back, let's talk more about the teeth whitening and the bleaching and the different procedures. We'll be right back with more with Dr. David DeCama.
Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv.
Welcome back to Maximize Living. I'm Dr. Patrick Andersen with our guest dentist, Dr. David DeCama of Madison's No Fear Dentistry. Welcome back.
Thank you.
We wanted a subject that many people are interested in and have a procedure done called tooth whitening. There's a lot of different approaches. There's things you can buy that sound like you can brush your teeth with this toothpaste and it'll whiten your teeth. What's effective and what's lasts the longest? And tell me about that.
I would say that toothpaste that say they're going to whiten your teeth are having some great marketing, but I'm not sure it's going to be effective. Okay, so what we know for sure is the two factors that change tooth color are how long the peroxide is on the tooth and how strong the peroxide is.
Okay.
Those are the only two things that matter. So there are some over-the-counter products like, Crest White Strips, and those work relatively well. And you put them on your teeth, they kind of stick there, and again, they hold the material pretty well to the tooth. But they will dilute over time with saliva. Salivary flow dilutes the chemical, and so they're only going to be so effective. The other way that we do it is we make custom trays, and you use fresh material straight out of the fridge that isn't expired, and put it in the trays, and the new materials you can use for 30 minutes. They actually have the desensitizing material in them, so you don't have quite as much sensitivity.
And that's with an upper and a lower plate?
Upper and a lower, yep. And the beauty of those is those trays are so well made, they actually keep the material in and the saliva out. So you keep that concentration on the tooth for the designated amount of time. Then the one step you can do further than that is an in-office whitening. And our whole goal there is to open up the porosity of the enamel so that your at-home bleaching will just work that much more effectively and faster.
And what are some of the challenges with it? There can be some inflammation?
We rarely see any kind of inflammation. What we do see is some sensitivity on the dentin or the root surfaces of the teeth. And again, that's why we're using the newer materials that actually have the desensitizers in them.
Right, that's great.
Yeah.
Another concern I have is what happens to people when they lose a tooth? Because the jaw and the occlusion is so important. What happens when someone's losing a tooth, and should they let that go? Can you let it go at times?
So let's talk about a worst case scenario. The tooth that I never want anybody to lose is the 6-year molar. It's the lower first molar. So I took one out of our model right here, and I'll show you kind of what happens. So over time, what's going to happen when you have tooth loss like this of the lower first molar? Couple things. The molar behind it wants to tip into its place. It doesn't move bodily like an orthodontist would move it there. It tips into place. So now you're trying to bite on the side of a tooth. The other thing that happens is the tooth on top wants to drop into that space, just like that. And now you have kind of a step in your bite, and it causes a lot of discomfort issues and inability to move the mandible and chew in a way that's effective, most effective for us to be able to use it.
Will other teeth more likely break then or be damaged, or is that not?
It's more about the chewing efficiency and the loss of vertical dimension. So the primary purpose of the back teeth, other than chewing, is to actually stop the mandible from vertical motion. So if you start losing back teeth, it's going to start putting more pressure on the front teeth, and then the front teeth will loosen up and have gum disease and all those issues.
You hear the term overbite. What's an overbite?
Well, an overbite,
crossbite,
yeah, so an overbite is a normal thing, and we want the overbite. So if you have, for instance, these are the upper teeth, these are the lower teeth, the overbite is just like that. And it's a good thing, because then when you move your lower jaw forward, it discludes, or the back teeth come apart and won't wear out. So an overbite is normal, right? And a crossbite, normally the upper teeth are a little bit wider than the lower teeth, and a crossbite is when the lower teeth jump the gap and go outside of the upper teeth.
And it happens on just one side, or would it happen typically on both?
It typically happens on one side, and we usually correct that right around age 9 with a palatal expander. It takes a few months to do it, and we can jump that back out there and get the maxilla to where it's supposed to be.
Great. Also, I wanted to ask, what are some of the most fascinating things you see in dental care now? What are you most excited about in the future of dentistry?
I am most excited about anything that makes it easier for the patient experience. So for instance, we now treat gum disease in many cases with a laser. It doesn't require any incisions, it doesn't require any sutures, and we can go in there with a laser and sort of microwave the bacteria and microwave the inflammatory tissue, and actually in some cases cause the bone to grow back up around the tooth. So that's one thing that's very nice. What's coming up is digital impressioning, so we don't actually have to use the impression material anymore.
Oh, that's neat.
I saw a scanner yesterday.
That can be a mouthful.
It can be a mouthful. And I saw a scanner yesterday that can scan the whole mouth in like 30 seconds, fastest one I've ever seen. So anything that makes it easier for the patient, I'm in favor.
I think you like toys too.
Amen.
Thank you very much, Dr. David Ducommun.
Thanks for having me.
See you next time on Maximize Living.
Have your questions for Dr. Pat answered on an episode of Maximize Living. Send your email to drpat@wi57.tv.
Thank you for watching our show on Best Dental Practices with Madison dentist Dr. David Ducommun. Hopefully we've shared the easiest and best ways to have great oral health and its importance for your body. Dr. David Ducommun's No Fear Dentistry practice is one of Madison's Maximize Living preferred providers. With dentistry, just like chiropractic, you just got to do it. I was impressed with Dr. Ducommun's state-of-the-art clinic, equipment, and kind, caring, and highly trained team. For a checkup, give Dr. David Ducommun of No Fear Dentistry a call at 608-836-5700. For Maximize Living, I'm Dr. Patrick Andersen. Until next time, live well and God bless.